Yes. Can you see me? Is the video working?
We can see and hear you perfectly.
Perfect. So we've spent a number of months, probably about 6 months, doing a bit of a scoping exercise with our colleagues in A&E. So we met with a number of different colleagues, both from the acute side and the psych liaison teams within the mental health trust side, talking about presentation at A&E of self-harm injury and self-harm ideation. And one of the big things that came out, there's a couple of things, but one of the biggest things was that there's a real sense that patients who present who don't necessarily meet thresholds for inpatient care or HTT care kind of get sent home with a bit of a, here's the crisis line number, but there's no real service for them. And then what the staff are saying is it breaks their heart, because regularly these people come back and back and back until they get to a point where they then do meet a threshold, so the severity becomes so high that they can then be referred to a service. So we've met with our colleagues in North Middlesex, because they ran a pilot, a very short pilot, has to be said, where they had a band 7 nurse and a peer support worker within their psych liaison team at North Middlesex Hospital, who, when somebody presented with self-harm injury or ideation and didn't meet relevant service thresholds, were then kind of put into this mini service that they had, which was very much focused on kind of a bit of therapy, but also supporting with more kind of like social aspects of issues, or things like more group work that they could be tapped into within the voluntary sector and that kind of thing. So we're currently scoping with our mental health trusts the possibility of piloting that in 1 or 2 sites. We have a number of hospitals across South East London. We've been looking at some of the presentation data to see where we're getting the most traction within which kind of A&E departments. But obviously, as you were touched on earlier, the data is not always that reliable, depending on how people are coding things, etc. So we're just kind of working with our trusts now to talk about where we can start the pilot, with the hope that we get it up and running within the next 3 to 6 months, with a view to doing a 6-month to a year pilot. A lot of the scoping work is also around outcome measuring. So the North Middlesex did do a number of outcome measures as part of their project and patient experience, but unfortunately they did a mid-pilot review, but they never did an end of pilot review. So the mid-pilot review was showing some really improvement in depression and anxiety type outcomes, and also improved patient experience. So we're just really scoping at the moment. So we've got the agreement from our steering group to go ahead. We have an allocated amount of money to proceed. So we're just very much on the kind of utilising their documentation and building a kind of a service spec and process map, etc., to take it forward, really. So I'd be interested to know if you're aware of anyone else across the country that's doing that we could tap into, because they're the only ones that we're aware of at the moment. But yeah, so it's a bit of a kind of pilot it and see how we go, really.